So the purpose of today's video is I'm going to lay the chair back. I'm going to show you how to seat a patient, how to sit a patient up afterwards. If the dentist is busy, then this is something you can do. So the chair is slightly high, so I wouldn't expect a patient to get on at this height. I would move the downwards pedal and ensure that the chair is as low as possible before that patient gets on. So that's what I've just done then, and then I'd expect mine then to get on. You do have a headrest at the back. There is buttons, just lean your head forward slightly. So there is buttons either side, so I will do a separate video so you can see that. So you push them in and you can move the headrests backwards and forwards. Once you've got the correct height, and if you just lay your head back, does that feel comfortable?
Yeah.
So check with your patient that they feel comfortable. Before the treatment starts, you can lift the patient up. Again, this is something the dentist normally does. So we lift the patient up to the correct area, and then you'd need to tip the patient back. So I'm using the backwards pedal, which I will show where it tilts backwards. So I'll put my foot on there. Always hold the chair just in case there's a default, and the chair can just flip back. Doesn't normally happen, but you do have problems occasionally. So does that feel comfortable?
Yeah.
So the positioning of the dental team, you need to bring your tray around. There's no point in leaving the tray over there. The dentist won't be able to get the instrument. So you need to bring it as close as you can towards the patient. And the dentist normally sits at this angle. And he'll sit with his legs under the chair. And as a dental nurse, I'm going to move around to this side. So I'm going to show you the positioning now of a dental nurse. So you do have this rest on the chair. I don't know if you can see. You can put this at the front rather than at the back. As you're going to be leaning, your back needs to be fully straight, and then you can use this as an armrest while suctioning in the mat. So on the chair, you need to ensure, I will do a separate video, there's a little pump underneath so you can go up or down. So this needs to be as low as possible to ensure that your back is straight and your feet flat on the floor. So again, you pull this round, ensuring that you're on an angle with the patient and your legs can interlock with the dentist and you've got enough area there. The light, that's on a sensor. When the dentist is ready to start, as a dental nurse, you need to ensure that the light is completely, there's no point in putting the light here, it's going to blind the patient. So you need to start off putting the light elsewhere. When the dentist is ready, or you could do this as part of nursing, is move it up to the mouth. Whilst you're in the mouth, and the tooth is being excavated or drilled out, you can move the light. It's not always down to the dentist. If you feel he's busy in the mouth and you feel that the light is not shining, please feel free to move this light. You should be in control of the light and the aspirator. That is your role as a dental nurse. I won't put this on at the moment, I'll turn it down because the suction noise is really loud. I would recommend you hold the pipe as well. If you're just doing that, it's going to bend. Wear and tear, this eventually does break. So if you hold the pipe, it's not pulling down and the aspirator tip and cable's going to last a lot longer. So with the suction, can you open your mouth please? We'll go in and we can retract. So you're retracting the soft tissues and you go in underneath. Again, I'll do a separate video. You should be in control of the light as well. It may be that you've got a mirror that you can't retract properly, and you need to hold a mirror and retract the tube so the dentist can see what he's doing. Okay, so once the treatment is finished, I'll show you how to sit the patient up so you can move your rest out of the way. So I'm just going to sit the chair up now, so let the patient know at all times what you're going to do. You don't want the light shining in the eyes, so always make sure you switch the light off first. Move it out of the way, otherwise the patient will headbutt it. Now there should be a default button, so you need to find what default button you've got, but you should be able to just press one button, like so, and it sits the whole chair up. You can then assist Let's pretend there's a rinse there. With the rinse, asking the patient to move closely to the sink and providing a tissue as well. If they're numb, you would say, Milo, can you just move closely whilst you have a rinse? Make sure that they're leaning over the sink because otherwise they're going to spit everywhere. Just make sure that you're here on hand with the rinse and the tissue. You support